some more of the skeleton. And we had stopped talking last time still about the bones in the head, right? So we had talked about the cranial bones, and there are some details here that I started to mention last time, but I did not mention in a lot of details that you should know because they're very interesting facts about those bones. So here we look at the palatine bones, and those bones are going to be inside of your head. The palatine bones are actually fused bones. Okay, so when you look from the inside of the mouth, you see that the palatine bones are right there on the roof of your mouth. Okay, and sometimes during fetal development, these bones do not fuse properly. And actually, the fusion of the bones will happen later on during the pregnancy. And when the fusion does not happen properly, you can end up with some fetal malformations that are seen here. In this case, this is a cleft palate, so palatine bone for cleft palate, right? And sometimes the cleft palate is only happening like at the back of the mouth. And that is a problem for the newborn and for the infant, because you can imagine that this opening is directly connecting the cavities for the nose with the throat cavity, so the back of the mouth. So everything is like kind of connected up there, and this makes it difficult for the baby to nurse. And you can imagine, especially if the baby is trying to breastfeed, it's going to be quite a challenge because there is not enough suction to actually help the baby to breastfeed. So the babies eventually have to be bottle fed, and it's still difficult because still the back of the mouth is open, so the milk a lot of times squirts through the nose. So it's a problem, but it's a problem that is easily corrected with some plastic surgery. Okay, so some other times you have not only a cleft palate, but an extension of this problem that goes all the way to the front, to the mouth of the baby. So we call that cleft lip. So the cleft lip usually goes with the cleft palate. Okay, and one of the risk factors for this type of malformation is lack of folate acid during the diet of the mother during the gestation period. So this is one of the B vitamins, so it's water soluble. And do you know where you can get folate acid? What is a good source of folate acid? Anybody? Yeah? Vitamin C is another vitamin, it's also water soluble, but this is a B vitamin. I always forget if it is B9 or B7, one of those two. No, B12 is not folate. B12 is cobalamin. Any guess where you can? Yeah. No. You guess fish, but no, it's not fish. Green leafy vegetables, yes. Somebody has babies in this class, right? Green leafy vegetables. Folate is actually derived from the word folia, which means leaf. Specifically green leaf, right? So, no, that would be folia verde, right? Leafy vegetables will give you folate. So eat your vegetables, especially when you're pregnant, because if you don't, you might be at risk for some malformations, right? So leafy vegetables, leafy greens. All right, so here is your palatine bone, looking from the front of a head. Remember, this is the coronal section of the head, so crown coronal section, right? So here, when you look at this bone, you see this U-shaped bone, which is not really telling you how this thing looks in 3D. So you just see this section of the U shape. So you see here, do you have some perpendicular sections? and then you have this horizontal portion here. And now you notice that the middle of this horizontal portion, this is when you're supposed to have the fusion of those bones. So you're going to have a non-articulating fusion, okay, contact of those bones. Now, when you look here at this planar section, you'll see that the fusion of the bone, if you look from the top of the head, you're going to see a little bit of a crest right there. So you call that the nasal crest. Now, if you look from under the bone, which here is a view from under the bone, you're going to see there is also another little crest that is going like down like this. And this here is going to be your palatine crest. So this is from the top of your mouth, inside of the mouth. Okay? And you see also from the inside of the mouth or from the top view, you see this flat portion of the bone, which of course you cannot really see here in 2D. Okay. So those are your palatine bones. Okay, and here comes your first question. And this one has to do with what we have seen last week. Remember, this is the part when you can consult your friends and you're totally, free to cheat in consultation, phone, look up your notes. So here is saying the scientific name for the cheekbones. What is the name of the cheekbones? Okay, 7, 6, 5 seconds. Okay, what is your answer? A, zygomatic. Okay, good confidence. That's your zygomatic bone. All right. And here more fun facts about your mandible. That's the only part that talks. I mean, that moves, and then talks. Okay, so it doesn't talk. You know what I mean? Okay. So the mandible, pieces of the bone that you should know. The part that is connecting with the cranium is part of this bigger part here that has this U-shaped kind of form, and this is the ramus. The part that has your teeth, you call that the body, so mandible. Right. Then there are more parts to it, of course. The part that it connects to the head, you call that the condylar process. So this sticking out thing process, you call it condylar process. You do have another very prominent process right there, but this is for attachments of muscles, and that is called the coronoid process. But I'm really interested in this condylar process right there, right? Because that's the only movable joint that you have. Okay, another important or prominent parts, the part that is connecting the body with the ramus, you call that the angle of your mandible. Okay. And then you have associated bones, right? And those are bones that are not quite connected to other bones. The first one that shows up here is this hyoid bone. So this here is right on your, right in front of your throat, right in front of your vocal cords, and it's a very important point of attachment for your tongue. So muscles that are connected, to your tongue. So here is your hyoid bone, okay, not connected to bones. And let me see what else is important for here. Okay, tongue attachment. So besides your hyoid bone, you have these other associated bones that are very, very tiny. Those are called ossicles, because that's like small little ossos. Osso is bone, right? Ossicles. And those you're going to find in your inner ear. So those are going to transmit sound waves to internal parts of your inner ear, like the cochlea and the hair of Conti and all the good stuff, right? So these are tiny, tiny little bones. And they have very strange names, like malleus, incus, and stapes. And they resemble some kind of tools, or the part of a kind of, what do you call that, the thing that you go on the horse, saddle, right? You have the saddle, and then the stapes, you step on the stape and you go on the saddle. I guess when these physicians or ancient scientists, they were giving names to these bones, they thought they looked like these tools. So yeah, strange names for the ossicles. All right. And another question, got tons of questions today. So this one says, which of the following bones does not articulate directly with any other bone? And you should absolutely know the correct answer for this. That is not articulating with another bone. Don't tell me mandible. Okay, so yes, time is up. What is your answer? That's your hyoid bone. Okay. All right. So a little bit more about the nose. So I mentioned before, you have a part of the nose that is made up of bone, and then another part of the nose that is made up of cartilage. So you should be aware of the bones that are composing the nose. Okay. So you have nasal bones. Here you don't see them. Next slide you see them. You have nasal bones. There's a pair of them, and that is important from the starting of the bridge of the nose. Then you have the frontal bone. So here, of course, nasal bone is right there, bridge of the nose. Frontal bone is right on the top of the nose, the start of the nose. Okay. And here on the sides of the nose, you're going to have your maxilla. Okay, so two bones on each side. That's your maxilla. And inside of the nose, here's a bone that you don't see. You're going to have your ethmoid bone, and you're going to have your vomer. Okay. So here are the bones that I just mentioned. Here is our nasal bone and the maxillar. So maxillary bones on both sides. And of course your frontal bone here. And the two bones that we do not see are from the inside. They're forming the inside of the nose. But you have seen those bones before. And the part of the cartilage that is composing the nose, of course, is in the superior part. And you do have two different forms of cartilage there, right? But just be aware of where you have bones and where you have cartilage, and also what are these main bones that are part of the nose. Okay. And we had briefly also mentioned sinuses before. So those are empty areas, so they're air-filled, and they're also lined with epithelial tissue. So you're going to have mucus, mucal type of tissue that is lining up those cavities, those sinuses. So you have a few sinuses that you should know, right? So the ones here, they're like right on top of your eyes. Those are sinuses in your frontal bone, so you call them your frontal sinus or frontal sinuses. Okay. Now, besides the frontal sinuses, you have also these spaces of your sphenoidal bone. So those are sphenoidal sinuses. Okay. As you can see here, the name of the sinus follows with the name of the bone that has it, right? And here are the more prominent sinuses that are right on your maxillary. Those are the ones that really hurt when you have a cold, when you have a sinus infection, right? So those are getting really, they get really stuffed up and makes it hard to breathe, right? Everything gets so congested. So what is the importance of sinuses? Well, first thing, they make the bone a lot lighter, because if it is empty space, that's not going to be packed with heavy stuff. So it makes it lighter. Besides, you have a good area to warm up and humidify the air once you're breathing, right? Breathing through your nose, especially here, your maxillary sinuses. You're going to humidify and warm up the air, and you're also going to filter out some pathogens. So you have the lining of those sinuses is with cilia that are able to trap pathogens and then push it out of the cavity. Okay. Besides that, it is also important to allow proper voice diction or diction, pushing out the proper vocal sounds. Okay, and as everybody has gone through the experience, once you have a cold and everything gets stuffed and congested, it gets very difficult to pronounce the right words, and you can't really talk properly, right? So you get like all these interferences with proper vocal function. So you have this resonance type of function for those sinuses. Okay. So here a little bit more that you should know about those sinuses, right? We have seen this before, the turbinates, right? Those we have seen when we study the bone that has those turbinate portions, which are totally going blank now. But okay, so here you have your sinuses. All this area here is lined with this mucosal tissue. So this is part of your respiratory mucosa. And this is when we go back and revisit some of the cells that are important for respiratory mucosa. So remember, this is one line of cells here, and they are ciliated, right? And they are tall. And it's only one layer, but it looks like it's several layers. So this is that classification that we call pseudo-stratified, ciliated, columnar epithelial cells. So you thought you would not have to look at those types of cells again, but you know, ta-da, they show up again. All right, so pseudo-stratified, columnar, ciliated epithelial cells. Those are the ones that are very important for producing the mucus. Right? Okay, so we know that they have under the epithelial cells, you're going to have the lamina propria, and you're going to have a lot of blood vessels and blood vessels supplies here. And it's interesting that some people have these blood vessels that are very, very close to the epithelial tissue. And when you have some allergies or when you catch a cold, sometimes just by trying to force the mucus out, you can break those little blood vessels, and that's when you can get nosebleeds. And they tend to be common for children, and for adults it's not as common, but during the formation year up to 25 years old or so, you can see having nosebleeds is quite common. And with that, we finish with the bones in the head. So now we go for the rest of the body. So looking a bit more here with your axial skeleton, right? So this is still this green portion here of the skeleton. And next thing we're looking at is the vertebral column, and that's kind of interesting set of bones to look at. Okay, so looking at the vertebral column, and after that we are going to also look at the thoracic cage, and that's going to be everything that we're going to cover for this lecture. But we still have the appendicular skeleton to cover. For that one, I will put up the self-study video. Okay, so for that part, because it's quite easy for the appendicular, then you'll be on your own. I'll put up the video, I'll put up the slides, and for that part you'll be on your own. All right, so here for your vertebral column, you have up to 26 bones that are going to be making up this vertebral column. Okay, and this whole column is divided into 5 sections. Okay, so you're going to start with a section that is at the neck, so that's your cervical section. And in the middle here, you're going to have your thoracic section. Then later down, you're going to have your lumbar section. Then you're going to go to the sacrum, and the coccyx is the last part. Okay, so looking here at each of those sections. Functions of your vertebral column, it might be very obvious, but just in case we don't see obviously what is the function, we do have them delineated here. So the first very important function of the spinal column is to protect your spinal cord and also to have nerves. They're coming out from the spinal cord and they're going to go to the rest of the body. So we're going to protect the spinal cord and the nerves. And besides that, it serves as support for your rib cage and also for tendons and ligaments and of course muscles. Okay. And when you look at specifically your cervical part of the column, it's very important for head support. You're going to also put your shoulder girdle that is going to connect to your spinal column, as well as your hip girdle. Okay, so both girdles are going to be connected to those bones. So upper and lower body are going to be connected. Now, some words that we have not looked at before, and these have to do with mobility. Of course, we're going to see more of these words when we study joint mobility. Here, mobility of the column. When you talk about flexion type of mobility, have you seen those in the lab already? Those are taking lab? Yeah, no, maybe? Okay, so when you say you flex something, you do this forward bending type of motion. When you say you're extending something, you do this backward bending type of motion. So forward is towards, and then extension is, flexing is towards, and then extension is away from. Okay. Now with the spinal column, you also have this side bending, right? Left to right, right? Side bending. And of course, rotation. They have the, of course, rotation this way, that way, okay. And then you can have a whole combination of those. You bend, you dance, you do the Macarena. Okay, so your spinal column is very important for those types of motions. Okay. So here, curvatures of your spinal column. Some of them you're born with, some other ones you develop as you are growing and you start to walk. Okay, so you have what you call primary types of curvatures. So your primary ones are the convex type of curvature. Again, we're looking here convex in relation to the rest of the body. Okay, so two primary curves, those are the ones you are born with. You have here your thoracic. So you see here, you're going to have your thoracic part, okay, thoracic curve, and you also have here your sacral curvature, right? So these two you're born with. The other curvatures that are concave, you develop after you start to walk, actually. And in case, so the first secondary curve that you have here, that is your concave, right? So this is going to be your cervical at the neck, right? So when you're born, you don't have that curvature. After you start, holding your head up, then you develop this concave cervical curvature. And the other one you develop is this one right here. So this is the other secondary type of curvature, and this is your lumbar curvature, and this is specific for primates or animals that are walking upright. Okay, because if you're looking at an animal that is walking on all four, then the animal is going to have this whole thing that is basically a big C that connects this whole part of the body. They're still going to have the cervical curvature, because even if you're walking all fours, you want to put your head up and look around. So cervical is going to be there, but this lumbar curvature is for standing upright. So here is showing a newborn baby, and basically is showing you that the baby looks like a comma or a letter C. Okay, poor thing. It's like only one curve there. So these are your primary curves, right? No other curvature, no cervical, no lumbar curvature for the newborn. Okay. So what's the use of the curvatures? The curvature is basically going to give you this springing action. So it's going to serve like kind of almost like a coil. So with the curvature, as you see between each of the vertebrae, you're going to have this cartilaginous tissue, and those you call discs, right? You remember the type of cartilage that goes in the disc? Huh? Fibrocartilage, right? Because it's really, really tough, especially for the outer parts of the disc. You have this fibrocartilage. So the disc is going to cushion this springy motion. And just for fun, I put Tigger here, like, you know, a springing type of thing. Although we don't have the tails for it. So you get the point here. All right. So problems with the column, wrong type of curvature. Here, we see this type of a hunchback kind of problem. You call that kyphosis, right? Now, if your parents are always reminding you to sit up straight when you're in the computer, when you're taking notes, right, when you're doing anything, just remember to sit up straight so that you do not end up with a hunchback. Is that true? All right, let's go for a vote. Who thinks yes, it's true? Should keep a good posture. Yeah, who thinks it's not true? Hey, who doesn't want to think? Don't tell. Okay. So it's true. Because remember that your bones are always being reshaped, right? If you're using your bone, you're going to be allowing it to do all the, you know, type of electrostatic reshaping of the bone. If you're always in this type of position, you're going to be teaching your bone to always be in that type of position. So you're going to develop the hunchback. Yeah. Oh, if you're already hunchback, can you fix it? It's better to prevent it. Once you are already in that situation, I think it's going to be more difficult. I don't think it's impossible, but I'm not sure without interventions, like surgical intervention. But I'm not sure because I'm not a clinician. I think it depends on the degree. But since you guys are all, you know, young, make sure you keep a good posture so you don't develop with this kind of problem, right? So that is your kyphosis. Right? Another problem that is quite common, lordosis. So this is when your back is like curved like that to the back, right? And for us women, if it happens when you go through pregnancy, you end up with some kind of this issue. Why? Well, because in front here of your body, you're gonna have this whole extra watermelon or two that you are carrying. So all this weight in the front, and if you do not compensate by pushing your back a little to the back, what's gonna happen? Center of gravity is shifting, right? So at first you're fine walking, then you got this big belly, and your center of gravity shifts. If you don't compensate, you just fall on your face. Bad thing, right? So you ended up compensating. So you see this pregnant women with the belly, they go like this. That's the lordosis, right? You can have a lot of back problems because of babies. So lordosis. And when you have a column that is misaligned sideways, there are many different variations of this. You call that scoliosis. So correction of this is really through surgery. Okay. Now with lordosis, you can recover, of course, after the baby is born, right? You can recover because there's so much more also involved with pregnancy and joints. During pregnancy, your joints become a lot more flexible, right? Because you're preparing for the whole delivery experience. So it's good to have more, joints that give away a bit like easily, right? And then after pregnancy, the body will recover most of the time. So you're not going to end up with this type of lordosis for like the rest of your life, right? But yeah, so kyphosis and lordosis, either hunchback or back bend type of problem. All right, so here looking at the bones of the spine, right? You're going to have here the bones that are making up your neck. You call those cervical, and you're going to have 7 of them. After the cervical bones, you're going to have the bones that are going to be part of the thorax, so thoracic bones. You're going to have 12 of them. And after your thoracic bones, you're going to have your lumbar vertebra, and you're going to have 5 of them. And yes, there is a mnemonics for that. Here, I eat breakfast at 7, I eat lunch at 12, I go to A&P class at 5. Okay, some people say they eat dinner at 5. I don't know anybody who eats dinner at 5, but you go to AP class at 5. Right? So 7, 12, and 5. Now, features of those bones. Right? If you look at the side of the column that is going like from cervical to thoracic and then from thoracic to lumbar, the bones are not so clear cut. Okay, but then of course, in terms of test taking, I'll give you a bone that is easily identifiable. Okay, so features of the vertebra. What you're gonna have? You have this bigger part that you call the body. Okay, so bigger part is the body. Then you're going to have a hole in the middle, very important hole in the middle, that is called the vertebral foramen. And this is where your spinal cord goes through. Okay? So at the back, you're going to have this spinous process, this thing that sticks up. So here, if you look, here is the belly and this is the back. Okay, so this spinous process is always at the back. So the body is always at the front, it's like going to the middle of your body, right? And then you know here your spinal cord is going to be going through that foramen. Okay. So on the sides here of the vertebra, you're going to have 2 processes. You call them transverse processes. Okay. What connects the transverse process to the spinal process is going to be this lamina section. So you have 2 of those lamina. Okay. What is going to connect your transverse process to the body, you call that a pedicle, right here. So 2 of them as well. Okay. So here you see from a side view, you see the spinous process, and you see here the body. Okay. Now, when you stack up each of those vertebrae, you're going to see that a hole shows up. Okay. So here, let me see, wait a second, there it is. Okay, so these holes here that show up only after you stack those vertebrae, you call their intervertebral foramina. So you don't see the hole if you look at only one of the vertebrae, but if you stack them together, you're going to see those holes that show up. And those are very, very important for passage of nerves. They're going to come out of your spinal cord. Okay, so connecting each of those vertebrae, you're going to have some also landmarks of these bones. You have at the top here of this vertebra, you're going to have here the superior articular process, and then at the bottom you're going to have the inferior articular facet. So there's a difference between the process and the facet. So the process is like sticking out a little bit, and then the facet is kind of like curved into the bone here. So you have a little indentation, like a little fossa. We call it a facet. So those are going to be points of articulation. Okay. Oh, another question. Full of points today. Okay. Which part of the vertebra is described as the flat disc? So this is the bone. What's your answer? The body. So that was A. Okay. Everybody got that? No? Do I have complaints that the thing did not go on? It said, okay, so I'm going to open it again. Those are the glitches, right? For our beautiful iClicker. No double dipping. Okay. So those of you who did not have a chance to answer, I already gave you the answer, so I mean, if you get it wrong, yeah, some people are answering wrong. That's amazing. You never know. Okay. So a few more seconds here, 5. So what is the answer? The body. And yes, I did have a few people who gave me some other answers. All right. So looking more here at your vertebral column, this part that you have your foramina, that's where you have your spinal cord that is going to go through, right? Right behind the body and in front of the spinal process, right? So here you see you have your transverse process across. You have this very prominent spinous process, and you're going to be able to distinguish from each section of the column which bone belongs to what section. Okay, so here again you see your disc, intervertebral disc, and it was important. Okay. Let's see here. All right, so looking at the different sessions and how you can distinguish which bone belongs to where. So the two odd bones for the spinal column is really the first and the second cervical vertebra. So the first one, you look at it, and it's this huge, huge circle. Okay. This bone is very, very important for supporting your head. And you see here, you're going to have these facets that are going to interact with the occipital bone, right? That's going to be head support. So that's going to be C1. Okay, so this is cervical 1. The numbering goes from top to bottom. So remember how many bones are in the cervical part? Only for this neck part. 7. You eat breakfast at 7, right? So you start 1, 2, 3, 4, 5, 6, 7. So those are for your neck. The first one is this odd shape one. The second one is even more strange than the first one, because besides being big and round, it has this tooth that sticks out, and that is called the dens. So C2 has also a strange name. It's called axis, okay, because of this dens. And then C1 is called atlas. And they're very easily identifiable. Okay. So talking more here about the atlas, okay, you have certain landmarks that will make it easy to spot. So first thing you're going to see here is that your cervical vertebra, they have these holes on the sides, and those are your transverse foramen. Let me see if I have animated here. Okay, so you have the transverse foramen, and the top part here that is going to articulate with your occipital bone, that is your superior articular facet. So you have it on two sides here. If you look at from the bottom side of your C1, you're going to have here your inferior articular facets. Okay? So those are going to be important for connection with C2. Okay? So the superior one is important for connection with the occipital bone in the head, and the inferior ones, these are going to connect to the joints with C2. Okay. So you look here at this big circle, you're going to have one arch that goes towards the posterior side and another arch that goes towards the anterior side. Okay, so let me see here. Okay, so transverse foramen is important landmark for this too. The important thing about this foramen is that they allow very important blood vessels to go to your head. Okay, so all of the cervical vertebrae, they have this transverse foramen on the sides. Okay, so all 7 of them, you're going to see the foramen, and for the other ones, you're not going to see. Okay, so thoracic, lumbar, you're not going to see that transverse foramen. Okay, so here, like this picture here, that shows you the occipital bone that is sitting on the C1. So those are those facets for C1. Okay. Now you look here, when you look at the C2, you see that big sticking tooth on C2. It actually goes towards your neck, towards the center of the body. Okay, because the back here is going to be towards the outside, the dorsal part. Okay, so you don't see, you see on C2 more of this orientation. Okay, so when you look here at the connection between C1 and occipital bone, that is important for flexion and extension of the head. So when you nod yes, you're actually articulating this connection of C1 to the occipital bone. Okay? On the other hand, when you articulate no, you're actually rotating around the dens, the head, rotating the head around the dens, and the C1 goes with the head, and the C2 stays in place. So the dens is really the axis here that allows your head to go on this rotating no movement. So here you see the dens. Another name for the dens is odontoid process. Odontoid, that is derived of tooth. Okay, so it's a tooth process. Okay, again, here you do see the little bit of the transverse process. Okay, so this is C2. Okay, a little bit of the transverse process, but not quite much of it. But then with C2, you start to see the spinous process at the back. C1, you don't see spinous process. Okay, C2, you start to see this bifurcated, meaning 2 sides of the spinous process. Okay, so here again is showing you that C1, that's your atlas, right? And then with C2, with the dens, and it's starting to show this bifurcated spinous process. Okay, so this bifurcation is another landmark for your cervical vertebrae. Okay, so you have the 2 important landmarks here. Landmarks. Okay. All right, so looking at the rest of your cervical vertebrae, again, you do have those foramen, okay, the 2 foramen, and you have the bifurcated spinal process, so that goes towards the back, right? And besides that, you're going to have this central foramen that is kind of triangular, okay? The body is not too big, okay? Because if you think about it, what is it that the neck has to support is basically the head. That's it, right? So you don't need a very big, strong body of the vertebra to support the head. So when you look at this, some people like to compare these bones to some animals. So some people thought that this thing would look like an elephant. So I put a comparison here of the elephant with the cervical bone. I don't really think it looks like an elephant. It kind of looks like a mutated elephant with two trunks, but oh well. It definitely does not look like any other of the two animals that you see with the rest of the column. Okay. So triangular, central foramen, lateral foramen. Okay. So when you go down the line here on your cervical spine, you'll see that when you get to C7, which is the last one of the cervical vertebra, you see this very prominent protrusion. Okay, so you should be able to touch that spinal process like right in the back of your head. So if you see here, the neckline is going to be C6, that is a bit going out, and then C7 is like really prominent right at the base of your neck. Okay, this is a landmark that is important to differentiate when your cervical vertebra finish and then when your thoracic vertebra start. Because at the bone 8 here, you start with T1. So there we go here for the thoracic vertebra. And yeah, comparison with animals. So here you see a very prominent type of spinous process. And you notice the spinous process is facing down. Okay, so if you're looking at this, this is the back of the person. This is the belly of the person. Okay, so this spinous process is always quite long in comparison to the others, and it is facing down. And if you compare here this shape with the animal, you end up with a giraffe type of shape. This one actually, I think it looks like a giraffe with a strange mouth. Okay, giraffe is with the mouth open. Okay, so you see here that you have the lateral processes that are equivalent here to the ear of the giraffe. Okay. So what else you're going to have? There are landmarks here. You're going to have a little facet on the top of this bone that is close to the body. So you call that a superior costal facet. And you're also going to have here the inferior costal facet. Those two are very important for connection to your ribs. Okay, so ribs are going to be connecting here. Actually, they're going to be between two of those vertebrae. When you compare the size of the bodies to the cervical size of the body, you see that those have larger bodies, okay? And if you compare here the foramen, the central or vertebral foramen, you'll see that it's different. The other one, the cervical ones, had a triangular shape, and this one is really more of a circular shape. Although this one is kind of in between, but mostly it is a circular shape. Okay. What important things here? Again, this really looks like a giraffe. This giraffe here is kind of like upside down, so I just flipped it to look more like the giraffe shape. Okay. Oh, another question. Which vertebrae have small bodies? Okay, a few more seconds. All right, what's the answer? A. That's your cervical. All right. All right. So here, going to your thoracic vertebrae is going to connect to your ribs. Okay, so you have 12 of them. So here, looking at a side view of your thoracic vertebra, again, you have here the body. You have those facets that are important for connection with the rib. And let me see. So let's talk more about the rib since we are, looking at the rib, right? You have here the part that connects with the vertebra. You call that the head. So right after the head, you have here the neck of the vertebra, and then you have this angle of the vertebra. Okay, the vertebra is considered a flat bone. Okay, so it goes all the way to the front of the body, and it connects by a cartilage, and this is your hyaline cartilage. Some of the vertebra connects by cartilage to your sternum, right in the front, right in your chest. Okay, so here. See what comes up next here. All right, so the last part here of your vertebral column is going to be at this region. So this is your lumbar. You have 5 of them, 5 lumbar vertebrae. So these guys here, they are going to support the rest of your body's weight. So the body is going to be quite big. And the bones themselves, they are one of the strongest bones in the body, okay? Because they do have to support the weight all in this little stretch of bones. I mean, if you think about it, when you look at, at the tissues and the organs and your belly here, the only part of your body that is supporting the rest of the body is really your lumbar part of your vertebra. Okay, so big bodies, and the spinous process is kind of different from the other processes. When you look here, you see that those spinal processes, they look like a little square. Okay, so it's not pointing down like you don't see the other processes here for the thoracic, but here, these ones, they're very much squared up. Okay, so when people are using comparison to animals, they say that this thing looks like a moose. Yeah, a kind of it does, if you don't shave this moose. So big head, and you do have the kind of the horns here, and all right, you're missing a central horn for the moose, but you get the point. Okay. All right, so important landmarks for your lumbar vertebra: strong, big body. Spinous process looks boxed. Okay, so squared spinous process. So it's it's quite easy to distinguish which one is your lumbar vertebra just by these 2 characteristics. Okay, let's see what else we have here. All right, so then we go to the sacrum. The sacrum is actually a huge part of bone that is fused by 5 different vertebrae. Okay, so 5 different vertebrae that fused together. Now, important things that you should know here. Those foramina that show up, they are not evident until the bones fuse. So once you have fusion of each of the vertebrae, that you start seeing that those foramina can be identified, and they are very, very important for exit of nerves. They're coming from your column, from your spinal cord. Okay. What you see here also is that you see this central kind of protrusions. You call this a crest. So you have the central crest, is also called the median crest, and this here is kind of evident that it was fusion of the spinal processes. Okay, that give origin to the central crest. Now, when you look at the sides here, you see those lateral sacral crests. So those are fusion of your lateral processes or transverse processes. Okay. Okay, so important things about the sacrum is that you have this large area that is called auricular surface. This is for articulation of your hip bones. Okay, and why do you call this auricular surface? Who knows why you call this auricular? Well, somebody looked at this and thought it looked like the earlobe, like the ear, right? So they named this auricular surface. Wow. Imagination, right? So this is very, very important here for that articulation with your hip bones that we're going to see next. Okay, so here you have the sacrum fused, 5 bones fused, and this is actually, if you think about it, this is the only point of connection between your legs and your hips to your spinal column. Okay, so these 2 joints here that are really going to hold your body in place. Okay, it's going to connect the legs to the rest of the body. Okay. So after your sacrum, you're going to come to this last fused bone here, and that is your coccyx. Okay, and it's called coccyx because somebody looked at it and they thought it looked like a bird's beak. Yeah. I mean, the other one thinks it's the ear, the other one thinks it's an elephant, it's a giraffe, it's a moose. This is the bird's beak. You know, I don't know what these people are drinking. Okay, so here, that's your tailbone. What is the use of your tailbone? We don't have tails, so basically there is no use, except when you practice some sports and you happen to land on your tailbone. It hurts like hell. It hurts a lot. You can see like the whole constellation if you hit your tailbone, believe me. If you ever went through the experience, you know what I mean, right? So what is making up here your coccyx? You have 3 to 5 bones that fused, and as I mentioned here, is basically useless. You can say maybe it's a bit of support to pelvic organs, but nah, it's useless. Okay. So that's as much as you need to know for the coccyx. You see something that is fused, 5 bones, and looks like a bird's beak, it's the coccyx. So here a little summary of the different shapes of your vertebra, right? So this one here, what is this type of shape here? That's lumbar, that's your moose. And this guy here is thoracic, giraffic, not thoracic, okay? And this guy here is the least looking like the elephant, that's your cervical. Right. So you should look at this and you say, oh, this here is kind of triangular, right? And it has those openings on the sides. So that's a telltale sign that you have a cervical. This one here with of course you're not seeing the spinous process here, but remember those are the largest spinal processes, and the spinal process is always pointing down, right? And then this one, the big body, is your lumbar. Bless you. Okay. So here's another comparison, and this one is showing you your spinal process, comparison of your spinal processes. Remember that here, for your cervical bone, you have the bifurcated spinal process, right? And thoracic bone, you have very elongated downward pointing. When you come to lumbar, you have the square-shaped spinal process, right? So if I put a picture like this on a test, would you be able to identify where that vertebra is coming from? Yes, does that look like a good test question? Yeah, I mean, I gotta have something to test you, right? Okay, so now looking at thoracic cage, okay, you have your vertebra, okay, and you have some vertebra that directly connect with the central bone here, that is your sternum, okay, and you have some vertebra that indirectly connect to the sternum. all the connections of vertebra to the sternum are via cartilage, and that is your hyaline cartilage. Okay? Now, importance of the vertebra is mainly to protect your vital organs, and also they serve as a point of attachment for your shoulder girdle. Okay? All right. So, looking here at your ribs. So here, your ribs, you're going to have your true ribs. Those are the ones that directly connect with the cartilage to your sternum. Okay, so you have 7 of them. Now you look here, if you count, okay, 1, 2, 3, 4, 5, 6, 7. 7 still has a cartilage that directly connects to the sternum. Now, if you go to 8, 9, 10, you see that they do have a cartilage that is connecting, but instead of connecting directly to the sternum, they are going to connect to the cartilage of rib number 7, and then rib number 7 will connect to the sternum. Okay, so these ribs here that are indirectly connecting to rib number 7, you call those false ribs. Okay. Now, besides that, you also have 2 other ribs here that don't connect with anything. They're also called false ribs, but they, besides being false, they are floating ribs. So false ribs do not connect directly, but when you call false, it can be all of those here, and then the last 2 are really the floating ribs. They don't connect via cartilage either. Okay. Other names of your true ribs, you call them vertebro-sternal. Okay, so it goes straight vertebral, directly connected to the sternum. The false one, they are vertebral, connecting the vertebral column to cartilage. So you call it vertebrochondral ribs. Okay, so vertebrochondral is 8 to 10, and then you have your floating ribs. Those are 11 and 12. So here, when you look here at your sternum, this is a very, very interesting bone, okay? Because now, again, those guys with a lot of imagination, they look at it upside down, and they thought it looked like a sword. So here is the part that you manage your sword. So you call that the manubrium, the part that you hold the sword. Here is the blade of the sword, you call that the body, and then the tip of the sword, you call that the xiphoid process. I don't know where the xiphoid comes from. Okay, so that's the tip of your sword right here. Now, the manubrium part is very important for a connection with your rib number 1. Okay, directly connects here to the manubrium, and it also helps to connect with your rib number 2. Now, rib number 2 is not going to connect to the manubrium, but is also going to connect with the body. So it's right at the junction, right there, of the manubrium and the body. There's going to be rib number 2 right there. Then the body is going to directly connect with 3, 4, 5, 6, and 7. Okay, with the ribs. Okay. All right, so this is one interesting fact about the body of your sternum, because some people do not have a total fusion of the osseous formation of the body, okay, of your sternum. And when that happens, you end up with a hole, or you call this sternal foramen, that is right here before the end of the body, close to the tip of the sword. Okay. At some point, it was thought that the hole could have been reminiscent of a gunshot wound, which is totally not true, because look at this. 4 to 10% of adults have that hole. It's kind of sick to think that 4 to 10% of adults got shot and survived. Okay, so no, it's just a malformation, which is very common. 4 to 10% of adults. If we're thinking we're about 100 people here, 10 of us have this and you never knew. Strange. Okay, so that's not a gunshot wound. So another question. Told you tons of questions today. Another question. This group of vertebra is the only group that articulate with the ribs. Which are the vertebrae that are going to articulate with the ribs? Hopefully it's working. Okay, was everybody able to put in your answers? Oh, good. Okay, so here we go for round 2 again. Okay, get ready. Go, hopefully. Working for the rest of the people? Again, if you voted the first, don't vote again. To figure out what to do with this iClicker. Right, what's your answer? B. That is your thoracic. Okay. All right. So here another slide showing you your true ribs and your false ribs. Okay. So there you have some studying slides that you can go back and study a bit more. Okay. All right, so here a bit more on the anatomy of your rib bones. This part that is going to connect with your vertebral column, that is called the head. Okay, so in the head, you're going to have 2 prominent facets. You're going to have one that is on top and one that is on the bottom. So we call that superior and inferior facet. In between them, you have a little crest, okay, between the superior and the inferior facets. Those are important for connection with your thoracic vertebra, okay? So the superior facet connects to the vertebra that is on top. The inferior facet connects to the vertebra that is on the bottom, okay? And after that, you have the neck portion. So you have the head and the neck. After that, you're going to have this area that is called the tubercle. I usually skip the tubercle. So you go here to the angle. When you have your rib that is curving, you call that the angle. Okay. So this whole shaft is the body of the rib. Okay. And then when you come very close to the end of your rib, this is when you're going to have the connection with the cartilage. So you have a junction point for your cartilage connection. Bodies, okay. So here is showing you the connection with your spinal column, okay, at the head of your rib. So here is the neck, and yeah, the one part that I skip over is also for connection of your costal facet. Okay. So let me see what else is important to know here. I already mentioned that. Okay, and before you go, one last question. Okay, everybody gets ready. Get ready. Okay, I'm going to press it. All right. Hopefully only one take for this one. All right. The major functions of the thoracic cage are what? So here, protect the lungs. Sounds right. To help expand the thoracic cavity during breathing. That sounds about right. To aid in digestion. And then A and B. Which one could possibly be your correct answer? So I'm going to open it. Okay. Hopefully everybody's getting this one right. Okay, 10 seconds. What is your answer? D. Okay, how many people didn't get it? I mean, didn't get the answer, the thing going. Only you? Okay, so I'll work with you individually. All right, so the answer here is D, is both A and B.